Hello, and thank you for joining. My name is Sarah Dume, and I'm the Manager of Risk Adjustment and HEDIS Audit at Martins Point, and I manage provider risk adjustment, clinical documentation, and diagnosis coding for the Martins Point Generations Advantage Medicare Part C Health Plan. In this presentation, I will discuss COPD documentation and coding for providers. As a reminder, the information contained in this presentation is for educational purposes only and is not meant to replace any clinical responsibilities or decision-making by the provider. Let's review a few statistics on COPD in the United States. Approximately 11.7 million adults in America are living with COPD. COPD costs an estimated $50 billion annually. Maine is one of 11 states with the highest COPD prevalence rate. Now let's talk about documenting COPD. Providers should document the highest level of specificity of the condition, if known, during the encounter. And here we have a visual of the COPD ICD-10 diagnosis family. On the left-hand side, the J44 category includes other chronic obstructive pulmonary disease. Some of the diagnoses that are included in this category are chronic asthmatic obstructive bronchitis, chronic bronchitis with airway obstruction, chronic bronchitis with emphysema, chronic emphysematous bronchitis, chronic obstructive asthma, chronic obstructive bronchitis, chronic obstructive tracheobronchitis, chronic obstructive airway disease not otherwise specified, and chronic obstructive lung disease not otherwise specified. On the top, there's J41 category, simple and mucopurulent chronic bronchitis. And on the right, the J42 family, unspecified chronic bronchitis. Additional documentation can also help identify current or history of tobacco exposure, use, or dependence. On the bottom is the J43 category, which includes emphysema. And some of the diagnoses that are included in this category are unilateral pulmonary emphysema, panlobular emphysema, centrilobular emphysema, other emphysema, and emphysema unspecified. Now we're going to talk about some specifics of COPD documentation in the outpatient setting and look at a couple of examples for illustrative purposes. During the encounter, providers should review and document the most current status of the patient's diagnosis to ensure accuracy of the clinical documentation. Unconfirmed diagnoses should not be coded in the outpatient setting. For the purposes of this example, we are going to be talking about the outpatient setting. On the left-hand side, we have compliant documentation examples, and on the right-hand side, we have non-compliant. The first example, on the left, provider diagnosis is COPD unspecified, code J44.9. Documentation states, COPD is well controlled with inhalers, no reports of shortness of breath, lungs sound clear, refill inhalers, continue current dose. This provider has described the current status of the condition and documented the current treatment plan. On the right-hand side, the provider diagnosis is COPD unspecified, code J44.9. The documentation states, presents with new onset shortness of breath, suspect COPD, has long-standing tobacco abuse, order spirometry. This documentation is not compliant because uncertain diagnoses cannot be coded in the outpatient setting. In this example, the provider was not certain about the diagnosis on this current date of service. In this case, the provider could have documented the symptoms as the diagnosis. On the second example on the compliant left-hand side, the provider diagnosis is centrilobular emphysema, code J43.2. The documentation states, spirometry and CT scan confirm presence of centrilobular emphysema. Using inhalers and seeing pulmonology every 6 months. Quit smoking 5 years ago. This documentation The provider is documenting the current status of the emphysema and specifying the type of emphysema, as well as discussing diagnostic findings and medication treatment, as well as specialist treatment. On the right-hand side, the provider diagnosis is acute bronchitis unspecified, code J20.9. The documentation states, completed treatment 6 months ago for acute bronchitis, no further symptoms, resolved. Continue inhalers for management of her underlying chronic bronchitis. This diagnosis is not compliant because the documentation does not match the code selected. The acute bronchitis was previously treated and now documented as resolved. Chronic bronchitis is the current status of the condition based on the documentation. Let's do a documentation check. Assess and document coexisting conditions that affect patient care, treatment, and management. Review and update the problem list and medication list. Document physical findings and comment on results. The documentation should show how the condition is being treated and managed. The assessment and plan should accurately reflect how the condition is being treated and managed. The diagnosis should match the documentation. Documentation of the diagnosis should support the ICD-10 code documented by the provider. Conditions that are resolved and no longer being treated may be identified by a historical diagnosis. The diagnosis should be documented to the highest level of specificity, if known, and when applicable, document the severity, laterality, or type. If you have any questions, please feel free to contact us at rasupport@martinspoint.org. Thank you for your time today.